Hi, my name is Mia. Today I'm going to be getting Lipo 400 and RibLux. I had Lipo 360 about 6 months ago, but I wasn't happy with the results with the amount of fat left, and then I also have like a little piece of like skin or like unevenness on one side, and it kind of like has an indent, so that was my biggest reason for, I guess, a revision surgery, and then just getting better results. But choosing Dr. Marshall was, I knew I wanted to do it like within the United States, and there's only like a select few providers, and I think his results spoke more than others, and then that's why, yeah, I wanted to do it. I think that like because I did have the other lipo, that it kind of already like showed me like the increase in confidence that I got from it, so I think this one like I'm gonna have better results, so I think the confidence is really gonna like be improved there, so I think that's what I'm most excited for, like not having to second guess wearing certain things or like just being more comfortable in my own body.
So our case today is revision lipo 400 with RibLux procedure. So just a few months ago she had liposuction done by someone else, but a lot of fat was left, particularly of her upper abdomen, her lateral chest area wasn't touched, and basically her whole upper back. And so she has quite a bit of fat that still needs to be removed. In addition, I'm going to contour her arms so that everything matches. She does have some contour regularities from the previous lipo. Like I said, I wasn't the one who did it, I wasn't there, so I'm going to do my best to help correct those contour irregularities. In addition, she has a very, very prominent chest, more of like a barrel chest. So we're going to do my signature anterior and posterior rib remodeling to give her a smaller waist, but also decrease the circumference of her chest. Going to be a great case. So one of the hallmarks of my Lipo 400 is the amount of areas that I do. And so I noticed that a lot of people that get Lipo 360, they never get this little side area done here. So like I mentioned, she's previously had lipo, but I don't see any evidence of lipo here. When patients complain of having a wide back or a big back, it usually starts here because this is contiguous or continuous with the back. And so if you have a lot of fat here, just lateral to your breast, from a back angle, that's going to look really, really wide. So that's why my Lipo 400 always starts with this lateral chest and this anterior axillary area. In addition, you'll notice there's still a lot of fat right here above her ribs, and so by removing this fat, that's also going to help to contour her waistline. So to start that anterior part of the Lipo 400, I went to the lateral chest and the anterior axilla. As you can see here, I got over 1,000 cc's of fat out just from that area. So based upon my best judgment, I don't think that area was previously touched. It took me probably like 30 minutes really to work that area in the sides. But it's gonna give her a nice contour to her breast and her upper back. So I finished the anterior part of the Lipo 400. Like I said, just a few months ago, she had Lipo 360 done elsewhere, but I was still able to pull out over 3.1 liters or 3,100 cc's of fat just from her lateral chest and her stomach. So that's a lot of fat left over. That's over 6 pounds of fat that was left inside of her, but I've removed that. I haven't even gotten to the back yet and to the arms, so stay tuned. Alright, so now we're moving on to the anterior portion of the rib remodeling. This has a twofold effect. Number one, we're looking to decrease the circumference of her chest. A lot of patients will have more of a barrel type chest, and so by doing anterior rib remodeling, we'll decrease the circumference and her underbust. The second thing is we want to separate the false ribs, which are still attached to the sternum in the middle, by false cartilage. So by weakening or loosening up those ribs, she'll get more of a waist reduction in combination with the posterior rib remodeling. Alright, so that's the anterior rib remodeling. That was 4 ribs in the front that I just fractured. So I first scored the rib with the piezotome, and then I went and put a little manual pressure to create a monocortical fracture. So right there in the middle of the screen, that's the rib fracture. It doesn't go all the way through the rib, it's just about halfway through. So I'm looking at a fracture of the rib right here in the middle screen. It doesn't go all the way through the rib, it goes about 50 to 60% through. Okay, so confirm I did 4 anterior rib fractures here, 4 anterior rib fractures here. The lungs on both sides look good, no injuries, and now we're gonna flip over and do the same on the back. So we completed the revision lipo. We were able to take over 3 liters off of the front, and then about 700 cc's each arm, and then nearly about 2 liters on the back. So as you can see, she had a lot of fat left over. So people ask me, well, what is Lipo 400? Well, it's a more aggressive form of fat removal, and that's why I'm able to get out so much more. People say, Dr. Marshall, why are you so expensive? I don't know, why do I put 4 hours into my lipo to make sure you're really snatched? It is what it is. So the final part of this case, we're gonna move on to the posterior rib remodeling. We're gonna address ribs number 12, 11, 10, 9, and 8 on both sides, and that will bring her waist in as she wears that corset. So we'll get started with that next. Super tough case today, revision lipo. So I did lipo 400, lipo of her arms, anterior and posterior rib remodeling. What made this case so difficult is slightly higher BMI. BMI was 30, so that makes for a tougher revision lipo, makes for tougher ribs, especially posterior, trying to get deep down to get ribs number 12, 11, 10, and 9. We're still able to create some great rib fractures, so we're definitely gonna get a more narrow waist, but super, super tough revision case.